Hello and welcome to our Mental Health Month conversation. My name is Linda Rosenberg and I'm on the faculty of Columbia's Department of Psychiatry. For 15 years, I was the CEO of the National Council for Behavioral Health, and before that, I was the Senior Deputy Commissioner for Mental Health in New York State. I'm pleased to be having our Mental Health Month conversation with two very special guests. Former U.S. Representative Patrick Kennedy and Dr. McCray Ashby, a child psychiatrist with innovaTel Telepsychiatry. And this conversation is certainly timely. We've all been consumed by COVID-19, and today we get to hear from two experts about the pandemic's effect on mental illness, addictions, and suicide. Before I begin the questions, let me introduce Congressman Kennedy and Dr. Ashby. During his time in Congress, former U.S. Representative Patrick Kennedy was lead author on the Mental Health Parity and Addiction Equity Act. In 2013, he founded the Kennedy Forum, bringing together advocates, business, and government. He served on the President's Commission on Combating Drug Addiction, and he's currently co-chair of the Action Alliance for Suicide Prevention's response to COVID-19. Also with us is Dr. McCrae Ashby, a child psychiatrist that has been working with innovaTel Telepsychiatry for the last 5 years. While Dr. Ashby lives in Kentucky, he provides psychiatric treatment exclusively via telepsychiatry. We're excited to hear about Dr. Ashby's experiences using technology to deliver care to children and their families. So welcome, both of you. My first question is for both of you. How do you think this pandemic will affect our nation's mental health? Are there long-term implications, and are there groups that are most vulnerable? I don't know who'd like to begin. Congressman?
Well, thank you so much, Linda, and thank you for your incredible service throughout a lifetime to the cause of mental health advocacy. That advocacy is going to transform what kind of services we're able to bring to people in need in this country. And if you ever thought that your work was not as important as it is, just understand that it set the table for what we need to have done in our country to meet this tsunami of need that's coming down in the wake of COVID-19. It wasn't enough that we were having a epidemic of overdose and suicide with record rates on both, that now we have COVID on top of that. And as you know, we never really made the full commitment as a nation to tackle either one of those, suicides and overdose. So now that this we're in today really puts us in jeopardy of having another COVID-19 in terms of our inability to meet this crisis head on. And we all know now, in hindsight is 2020, that we could have done a lot of things that would have made this crisis a lot less worse than it has been. In fact, we knew it was going to be bad, but as we all know now, we never took the necessary steps to prepare for it. And that, I think, is really the worry we have coming forward with the mental health and addiction crisis. We know it's coming. And the question now is, are we going to prepare for it? Or are we going to let ourselves fall victim to reacting to it like we ended up reacting to COVID-19, and which, of course, has taken too many lives in the process. So I think this is a timely conversation, let alone for the fact that it is Mental Health Month. And thank you for allowing us to join you in this conversation.
Thank you, Congressman. You know, Dr. Ashby, I was just wondering if there are populations that are more vulnerable and that should be highest on our list of those we're concerned about in terms of mental illness, addictions, and suicide.
Absolutely. First of all, thank you, Linda Rosenberg and Patrick Kennedy, for allowing me to be here today to help bring awareness to the importance of the mental health field. But definitely during the times of this pandemic, we're already seeing rises in child abuse, rises in domestic violence. if you're going to add to that rising unemployment rate, financial stressors, and even beyond that, just the constraints of social support systems with the regulations and the precautions in place, people may not be able to access those support systems that they normally do. Taking all of that and combining that on top of an already overly stretched, thin mental health care system, it's going to be extremely taxed. And it's going to be very difficult for that mental health care to take care of those vulnerable populations, the children, those suffering with substance abuse, severe mental health illnesses. However, not to sound too dire, this is also an opportunity for exponential potential and opportunity. The old notion and mindset of this is the way it's always been done is completely shattered with this pandemic. So we can use this time to visit and revise those outdated regulations and policies that have just been very slow to change over the years. Or we can use this time to really explode what was already growing with telehealth, the access to communities and improving that care. So we can really use this time, while it will be rough and it's going to get rougher for mental health, we can use this also as an opportunity to set not just maintaining, to improve this platform as we move forward.
Dr. Ashby, let me follow up and ask you about your experience. This is new for many. People seem to be very pleased, but you actually have years of experience in treating children remotely. Could you describe how that works a little bit?
Yes. So describing how telepsychiatry works, I think you might need a little bit of background about where I came from before doing telepsychiatry exclusively. I was in private practice for a number of years and just got to the point where I needed a change. And I will admit that I was very hesitant about doing telepsychiatry because I had no prior experience. However, once I started doing this, one of the larger hesitations was, will the families be able to maintain that quality of care? Will I be able to connect with those families? And I quickly found out that hesitation I had was unwarranted. There are many things that can be done to improve that connection with the families, even though I'm not physically there, and I've never had that as a problem connecting with those families. For instance, if I have a child who, let's say, is very rambunctious during the appointment, or a child that's not engaging in the appointment, I may just take a moment, stop the appointment, and let's talk about something else. Let's talk about pets. And if they have a dog, I'll bring in my dog. Since I work from home, I have that flexibility. And all of a sudden, you see the stress of that child settle down, the families open up, engage. So I think when we're working with families, we have to be aware of how do we engage them virtually, because we don't have those interpersonal reactions face to face. Another thing I believe that gets overlooked a lot is simple office decor. For instance, right behind me, I have a picture that I rotate out every about 4 to 5 months just to engage conversation with families and kids. And I use that actually as a teaching moment too. I will put up historical figures that may not be well known. So right now I have Dr. Mae Jemison behind me. She went to Stanford at the age of 16, medical school at Cornell. After serving 2 years in the Peace Corps as a medical officer, she became the first African-American female to travel into outer space. And then afterwards, she ran a biotechnology firm. So I use these examples as they're great ways to connect with families, because I had a teenager come in excited to see her because she didn't think anyone knew about her and she was doing a research project about her. So I've been doing this for years through telepsychiatry, and I've not seen any problems with the quality of care or accessing that connection with the family.
You certainly are connecting with me, I have to say. So I can see how engaging you are. And that is a great tip you've just given everybody about the picture behind you. I will share that actually. Congressman, because of COVID-19, federal and state restrictions on using telepsychiatry have been lifted. Telehealth is now easier for providers and patients. How do we ensure that regulations that allow us to prescribe and evaluate new patients stay in place once the crisis hopefully ends?
Well, that's why we need to organize advocacy now and create a new normal and make sure that the best aspects of making those reforms stay in place, and the learnings that come from that new approach to delivery in healthcare are also taken into account, because there may not be the kind of adherence to kind of evidence-based treatment protocols in telemedicine that we would like. And because it's so new, there aren't the strong accreditation agencies to ensure that people are getting the same quality that Dr. Ashby was speaking of. And so for all of us, if we want telemedicine to work, we've got to make sure it works effectively, and that the people who are doing it with fidelity to best practices. I'm proud to say innovaTel has a background, frankly, in that type of rigorous translation in delivery of services through the work that they historically have done through the community health system, which, as you know, Linda, really is a way to learn your skills. If you have to learn them through the rigors of trying to balance budgets and integrate care and address all of the social determinants and do all of that in a way that's seamless. So the people that started innovaTel have that DNA in them, and that's why they bring a certain level of skill that needs to be recognized that maybe not all would bring to this space. So we hope that the progress that is being made and some of these reforms stays in place. We just saw yesterday, in fact, that CMS, the Centers for Medicaid and Medicare, allowed for telephone-only reimbursement for a broad range of mental health services. This was big because not everybody has the kind of ability to get online as we do right now through our devices, because of the fact that many aren't have that connectivity. So we have to have that reimbursement. Thankfully, CMS saw the value of that. Many states are requiring full telehealth coverage, and frankly, they're doing it at parity with in-person coverage. It's a new form of parity, Linda. You know, we've been fighting for parity in the equal coverage for mental health as with medical care. Now we need a new parity, and that is to make sure parity is equal reimbursement for this virtual care as there is inpatient. As Dr. Ashby can tell you, many feel that some of this virtual care, especially in mental health, is not only as effective, but in many instances more effective. And when you hear Dr. Ashby talk about the other abilities that he has as a virtual provider, it really gives you a sense as to why kids could, in many instances, has shown us. And finally, let me say, the ERISA plans, as you know, about 80% of the whole market is these self-insured plans. They do not get the mandates that these states are putting forward with telehealth coverage. So frankly, I think we need to get Bill HR 6644, which would mandate that telehealth coverage is offered in all ERISA plans, at least through COVID, but certainly afterwards. And I think this is a time for us to get that done. To Dr. Ashby's point, this is the best chance that we have to kind of skip over a lot of years of waiting for it to happen, to get it actually done sooner, and people will benefit from that if we get it done. So a lot going on, and we're thankful the Congress and CMS are making some changes. But the end of the day, it's all in the payment. If you reimburse for this, you will see, you know, if you build it, they will come. If you reimburse for it, it will happen. We need it, but one of the reasons why it's not getting blown out to the extent that it needs to is that we're still not paying for it. In spite of the good effort of a lot of people to mandate, I mean, I think most payers realize that this is actually in their interest to pay for when but it's just something we got to keep pushing, because payers are by their nature reticent to do this type of shift in how they do business, especially when it involves them reimbursing. for something that they see as new. So we have a lot of work to do on the advocacy front.
Thank you. You know what I've been thinking, Dr. Ashby, and I really was reminded of this by many of our young residents who were deployed into inpatient in ICUs, and they got to talk to a lot of the families of the patients, is that in some ways, telepsychiatry can make access to families a lot easier because you're going to them rather than expecting them to come to you. So I wonder, Dr. Ashby, if you could talk a little bit about your experience in working with families and also involving others who are helping that child, whether it's social workers or teachers. You know, what's your experience been and how does it work?
And absolutely. So I live in Kentucky, but I work in Pennsylvania, which is always interesting telling my friends that I live here but daily commute to Pennsylvania. However, the team approach is the absolute in all of medical care, especially in mental health care. So how do we go about engaging the families and the staff that we work with? The simple answer is availability. We need to be available to those. So for instance, when I'm at my clinic working, in between patients, I'm still on screen and available to the staff. So if the front desk staff needs to come in, if the nursing staff needs to come in, the case managers, the therapists, the admin, I'm available there. So it's just as if being in a real office, we're coming in, we're discussing cases, we're talking about cases in between my regular patients, and we're having that team approach to it. And the same thing goes with families. When I'm seeing a family, they may all be in the room together, but frequently, if I need to speak to a child or a teenager or a parent alone, I'll have the other party step out in the hall for just a second so we can discuss and then we may switch. In fact, I do that with all teenagers just to make sure that they have a chance to talk in private. So that team approach is very important. And even to the fact of having medical records involved, getting records from the school, collaboration, rating scales, getting all of that information is extremely important. So I think having that access to the staff virtually, even though I'm not there, I'm still a virtual member of the team, going to team meetings and everything like that. I will add, just living in a state, but working in a different state, that it was a challenge, I would say, for me to close my private practice here, because I knew locally my families that I work with would have reduced access to care. So another aspect of telepsychiatry, I made a promise to myself that when I close my private practice, I would have to see more families and provide more care, or I'm coming back to what I was doing. So without telling innovaTel, the company I work for, I actually kept track of the number of families and the cases that I were seeing just to make sure that I was fulfilling my promise to myself. And so what I found through telepsychiatry, I was able to provide the quality of care, be more of a member of a team, and increase access to care because I was seeing more kids. So it helped me fulfill that promise I made to myself.
So this is a situation where both the practitioner, you, the doctor, and the patients are happier. That doesn't always happen in a change, but this is a change where we see increased satisfaction. That's pretty exciting. Congressman Kennedy, as a result of the pandemic, we know that telepsychiatry works, but how do we know what company to choose? In other words, why innovaTel?
Well, I believe that we're going to learn a lot of lessons through this process. And among those lessons are people do not have privacy when they go on their Zoom and they think that they're having a psychiatric consultation. There's nothing that can be told built into the workflow of an EMR. All the things that are essential to, continuity of care and having that care have itself reflected in terms of the best clinical protocols, right? So this isn't just kind of like concierge, let me call up somebody, whoever I get on the phone. That may be what most people think telepsychiatry looks like. innovaTel, really to their credit, has stayed true to the fidelity of a very rigorous model of ensuring that people, their clinicians, are adhering to best practice and the evidence base. They select their clinicians very carefully because they come from a background where, you know, there is great respect for those that are practicing at the top of their license, at the top of their game, in the parlance of the general public, and they deploy those people in a way that is not only effective for them, but is rational in the delivery of care for those that they're working with. And they work with healthcare systems that don't want telepsychiatry to be a one-off, but they work with systems where telepsychiatry is embedded into the overall care that a person receives, so that whatever else that patient is being treated for, that all their clinicians know that, so that they can appropriately understand, you know, even if it's the prescribing of medications, you know, that those medications for other illnesses are not counteracting medications that may need to be prescribed for telepsychiatry. I mean, these seem like obvious things, but unfortunately it's the Wild West out there. And innovaTel is one of those that I think is going to shine in this process, because people are going to know, if they want, you know, credible companies that know how to do this with fidelity and with professionalism, that's what they get if they get innovaTel as their partner in this. And I might add, it's their partner because they work closely, as I said, throughout the organization, not just as some add-on or extracurricular type of approach. So big believer in their professional their team.
I want to thank you both so much. Anyone who watches this can see why Patrick Kennedy is our hero and the leader of our behavioral health movement, and can see how fortunate they would be to be treated by a professional like Dr. Ashby. Thank you so much for joining me today. I look forward to seeing you both again. Bye.
Thank you so much, Linda. Thank you, Dr. Ashby.
Thank you both. Thank you.